today our topic, we're looking at 12 key symptoms of brachial neuritis. But what is brachial neuritis? Brachial neuritis is simply the inflammation of the bundle or network of nerves that come out from the spinal cord to our shoulder and arms and chest. So simply, if these nerves are inflamed or irritated or sometimes damaged, it leads to what is called brachial neuritis. How do you recognize you have brachial neuritis? Number one symptom is severe pain, sudden severe pain in the upper arm or shoulder. Sometimes it can spread to your chest, and when it spreads to your chest, you may be short of breath. So that's typical symptom of brachial neuritis, shortness of breath. And also when it spreads to the chest, you may have chest pain. If you're not careful, you may mistake it for heart problem, but it may not. The other symptom is the pain in the shoulder normally happens on one side. We say it is unilateral, it's just one side. So 80% of the pain is just one side, not bilateral. It means not both sides. Okay. Another symptom here is that the pain can go on for a few hours or days, and the pain may subside or it may decrease a little bit. But when it subsides, it will then it will go into some sort of transition or move to weakness. So you may have a weakness in your muscle, the muscle in your shoulder, in your arm, and sometimes some individuals may experience paralysis, right? But that is not too common. But the weakness, you may feel that weakness. Symptom number 4, lack of muscle control in your shoulder. So you may not be able to lift your arm very well, maybe above certain level, or maybe get it over your head. So when you have that limitation, it means that you may have a brachial neuritis. Symptom number 5 is that you may lack sensation or feeling in your shoulder. So when you feel that there's nothing there, okay. Another symptom here, symptom number 6, is numbness or tingling in the arm or shoulder. So you may have that numbness, tingling. And when you have numbness, on your chest, you may feel that you have a chest, you may have a heart issue, but it's not a heart issue. People are misdiagnosed in the hospital, but if you're not careful, they may give you different treatment. That's why it's important to combine about 4 or 5 symptoms to know that this is really brachial neuritis. The other symptom is muscle atrophy. When you say muscle atrophy, the affected area, you see the muscle a bit decrease in size compared with the other side, which is not affected. So there's a shrinkage or decrease in size of the muscle of the affected area. Number 8 is the shortness of breath when the nerve supplying the diaphragm, that's the chest area, is affected. All right. Number 9 is the pain gets worse when you move your shoulder. Normally, when you are sitting quietly, you may have the pain, but not too severe. Immediately you move your shoulder, you start to feel, the pain gets worse. All right. Symptom number 10 is that normally nothing can stop the pain unless you take the strongest painkillers, and that means that the nerves are involved. So if you have any pain in the body and you take anything, it doesn't work unless you take the strongest painkillers. It means it's involving the nerves. Number 11 symptom is the individual may experience what they call partial shoulder dislocation. So you may feel that you may have a feeling that your shoulder blade is partially dislocated. Okay, so that is another symptom among some individuals. The last symptom, number 12, is called winged scapula. It means that when your shoulder blades stick out, So you may feel that your shoulder blade really sticking out. That is also a quite typical symptom. So today we've learned about brachial neuritis. We know what it is. We know the 12 key symptoms. You may be listening to me. You may have this problem. If you have any form of chronic issues, it may disease that have been in your body for a long time, don't hesitate. Be a blessing to somebody. Share this number that I'm going to put on this platform. And then you can also visit me on my YouTube channel. But first, the numbers calling outside the UK is +44 738 464 7300. If you're calling within the UK, it's 0738 464 7300. It may be you or not. Just share the number, be a blessing to somebody, and God will bless you for that. You can also visit me on my YouTube channel, and when you go there, subscribe so don't miss any of the future programs I put there. I put social programs there every week, so don't miss. And when you get there, also click the like button to support me, and God will bless you. Share the presentations there. Be a blessing to somebody, and your life will never be the same. Put in Dr. James Natural Link. Dr. James Natural Link. That is the YouTube link. You can just get on and subscribe. Beloveds, thank you so much.